Welcome back to Season 2 of Cureus Conversations. Today, we're joined by Dr. Joerg Leheste and his students, Jessica Byron, Melba Avalos, and Amy Xiao. Hi, guys. How are y'all doing?
Hello. Good. How are you, Shreya?
Great. So, Dr. Leheste, today we're going to be discussing a new paper that you wrote called Health Equity in a Post-Roe versus Wade America. So, Dr. Leheste, before we jump into your paper, could you tell us a little bit about your background?
Yes, of course. I'm a cell and molecular biologist by training, and I received my education in Germany, moved to the States 20 years ago in 2002, and I had been working on kidney physiology until then, and that just got too boring to me, so I switched into neuroscience, and that's what I've been doing ever since. I started with New York Tech in 2005. I left in 2018. I returned in 2020. And then I started the Health Policy Research Initiative. And the work that was just published by my students is part of that initiative. So I'm working on putting a health policy research center together at our school. And as I indicated before the interview, there will be one paper after the other now.
Fascinating. So what exactly drew you to health policy research and I guess the health policies that we're going to be talking about today?
Well, I've lived over 30 years in Germany. Healthcare is handled differently than it is here. So there, everybody is insured. And so here, the situation is that not everybody is necessarily insured. But the primary reason for bankruptcy is actually health related in this country. So because I've lived with a different system and know how things could be, that got me very interested in health policy. So, and then in 2016, my dean recommended me for the osteopathic health policy fellowship, and so went through a year-long training process. And so then when I returned to NYT, to New York Tech, the medical school of New York Tech, I brought that knowledge with me and started the Health Policy Research Initiative.
Fascinating. So this is a question for you, Dr. Leheste, and your students. How did the circumstances at the time of your writing this paper influence your decision to write this paper?
So when we started in February of 2022, the Supreme Court had heard the Mississippi case in December. So we were awaiting the decision. And we spent a number of months considering what the health policy implications would be if Roe v. Wade were overturned, which it ultimately was last June.
So let's take a step back for our viewers. Could you explain the recent decision to overturn Roe in America?
So the decision ultimately leaves the decision for abortion to the people and their representatives, which at a political level at the moment has left it to the states. So states have policies anywhere from allowing abortion at a woman and her doctor's discretion to a nearly complete ban regardless of circumstances. The three students live in Arkansas, where we have a 6-week ban with no exceptions for rape, incest, or life or health of the mother. So while it has been a state-by-state decision-making process, there's nothing in the decision that would prevent Congress from enacting a national ban if they chose to do so.
Well, this is, as Jessica pointed out, another zip code conundrum. So the kind of health that you receive and the quality of health, if things are shifted into the state's hand, depends more and more on your zip code. And that produces enormous inequalities across the country. And that is a problem.
Yeah, and that's a problem that you address in your paper. So now let's dive right into it. Can you walk us through the findings of your paper?
Right, students.
So one of the findings that I can talk about is currently we've already seen like rural states have a lot of shortages of physicians, and we believe that with this coming into effect that the shortages are just going to get exacerbated. We recommend that it be physicians be interviewed of whether their choice of going to that state or not going to that state was influenced by the health policies in that state regarding if they're going to be affected, if they want to perform certain care for their patients. So we think that the shortages that are currently in rural states are going to worsen and get just increase in the shortages. So that's one of the things that we found.
Yeah, and another thing that we found was that with more limitations on abortion, we'll see like higher mortality rates and infant mortality rates overall, and then that's going to add on to like state budgets, and because states have to spend more money on the healthcare system. As of now, it doesn't seem like states are prepared for the consequences. So we really want to like address that problem and like let the people know like what's actually going on.
Jessica, anything you would like to add?
So one study that we had relied upon fairly heavily, the Turnaway study, which was published in 2020, discussed the repercussions of being turned away for an abortion, which included children who were born under those circumstances not meeting developmental milestones in the same numbers as their peers, women being more likely to live in poverty and to stay with an abusive partner. So we're looking at health equity issues in terms of zip codes, but also in terms of women's financial circumstances when they are seeking an abortion. Because if you have to travel out of state, if you have to fly, if you have to take off time from work, we're seeing that that's going to have a larger impact on women who may already be living on the edge of poverty.
So I want to touch on something that Melba actually said earlier. So how could this decision affect the future of healthcare in both like rural versus urban areas? Will it widen that disparity? What foreseeable effects would you say there are?
I mean, we definitely think that it's going to create a bigger disparity. For example, California and New York are already announcing and being very clear that they're going to be sanctuary states. So we expect they're going to see an influx of physicians accepting patients from outside of the states to perform abortions for patients that live in more restrictive states. So I think that physicians who also want to perform abortions might also choose to work in places that align with their values, for example, such as California or New York, and places that are widely accepting that and providing that kind of care, versus in places like Wyoming, who they already are very clear about having a shortage of physicians. If my values don't align with, I don't agree with not being able to provide certain care for my patients, why would I choose to go there? So we do think that that's going to create a big shortage of physicians in places that are already low.
Yeah, and on that very note, what are the foreseeable effects on healthcare professionals as well as pregnant individuals?
Go ahead.
We went to a conference about this. It was one that was presented at our school. The legality situation is very unclear. We heard a physician from California speaking on this behalf that, it's still very unclear about the legalities of all of this, of what's going on, but there are some shield laws, I believe they're called, they're trying to work on those and have those be more clear so that physicians are not scared of what they can and cannot perform. But go ahead, Jessica, if you want to expand on that.
So we're already seeing some consequences in terms of pregnant individuals. Ohio has a 6-week ban, and we heard a lot this summer about a 10-year-old who was raped and impregnated, needing to travel out of state. Our neighboring state of Tennessee also has a 6-week ban. And there was a patient who had to be transported earlier this year to North Carolina, the closest state that doesn't have that sort of ban, because she was experiencing eclampsia. And by the time that they got to North Carolina, a 6-hour trip, she was in kidney failure. Physicians are also facing laws like in Texas, where performing an abortion, almost regardless of the circumstances, can lead to life imprisonment.
Truly a devastating situation that leaves no winners almost. So thank you so much for sharing this very impactful, very timely paper with us. I want to end with one more question. What work do all of you have planned for the future in public health or otherwise?
Jessica and I are actually planning to continue this work. We have a long-term project in the works that we're trying to gather Dr. Leheste on board and other faculty from our school. We want to propose to get an amendment on board for Arkansas to protect abortion rights there.
Fascinating. And what about you, Dr. Leheste?
Well, you know, one group of persons who are very much affected that are very little talked about and that really don't have representation are children. So I have another group, and you know, this is also open to this group, who is focusing right now on what this overturn of Roe versus Wade means for our foster care system. So let's face it, we have a broken foster care system, and if we, due to those changes, end up with more foster children, that will definitely cause issues with the quality of foster care because there's already not enough money available. And so I think we also need to talk about children that are unwanted and their fate. And so I think that's very important, and that's where I will focus next, coming from this project.
Well, I'm looking forward to hearing about that and reading it. And finally, what about you, Amy?
I think as for now, like I'm more focused on what the medical community is doing in response to the current situation, and also like focusing on research that actually analyzes like physicians' perspective on abortion and how that's going to impact them. And also, like, I just saw an article today that the medical community is actually planning to like invest money on programs to allow more students to like have access to learn abortion, because many programs are banning it. So I think that's one thing that I'm like interested in and I'll look more into in the future.
Sounds good. Well, it was a pleasure to speak with all of you today, and thank you so much for once again sharing this with us.
Thank you for having us.
Thank you.
Yeah, thank you for the opportunity, Shreya.